Dr. Priya Sareen, the Imaging Director for Breast Health Services in the Lehigh Valley Health Network, joins our Janine Lassant in today's news feature. She discusses mammograms, the COVID-19 vaccines, and more.
Basically, mammograms capture a portion of the armpit region, also known as the axilla, and it's normal for us to see lymph nodes in that location. Whenever a woman gets a vaccine, it's normal for those lymph nodes to swell as the body forms antibodies. And certainly the COVID vaccination is one that is on a wider scale and happening currently. So we're seeing women coming in for their screening mammograms with lymph nodes that are swollen on the side that they received the vaccine.
We want to emphasize the awareness of getting their mammogram if they've had their vaccine. So if you can explain the importance of that.
Both are important, right? The COVID vaccination as well as an annual mammogram. What we're trying to do is prevent women from coming in unnecessarily for repeated tests and imaging that lead to anxiety. So we are really stressing that women, if possible, have their screening mammogram done before the COVID vaccination or 4 to 6 weeks after they're done with vaccination.
If they do come in for the mammogram and you do find that they have the swollen lymph nodes, then by medical reasons, you have to have them back in. So that's another screening, another mammogram, another maybe unforeseen bill, just a lot of stress and anxiety on the patient.
Yes.
Is there a time limit of when they got the vaccine to when they get the mammogram that you're seeing these symptoms?
I mean, it seems right now, and this certainly could change because we're right in it now, it's really just picking up now. It seems that about 4 to 6 weeks after that second vaccine, those lymph nodes, the swelling should go down, so it won't be as evident. And not every patient has it. It should be noted. So what we do is, women who come in within that interval, they are offered the chance to reschedule their mammogram, but sometimes they don't want to do so. Life is busy. They may not have another opportunity. Maybe they took the day off, in which case the technologist just documents it for the radiologist so that we know, okay, they got their vaccine on this side. Maybe that's why we're seeing this, but we're still going to have to call them back and evaluate them.
If you're scheduled for a mammogram or need a mammogram, there's a reason for, explain the difference between the screening and the diagnostic mammograms.
We have two different types of services that we offer. One is a screening mammogram. That's a routine annual examination starting at the age of 40, indicating that you're not having any active problems. Just coming in for that routine annual examination. A diagnostic mammogram and ultrasound is often performed when a woman has a new problem, such as a lump. They're feeling a lump in their breast. Perhaps they have focal pain or nipple discharge. Those appointments, we're continuing to ask that women keep them because they're having an active problem. We don't want them to wait 4 to 6 weeks. So it's really important that they still come in.
How has it been working through the pandemic? Have you seen more people pretty much holding off on getting their mammograms? Are you seeing more people maybe scared and wanting to take care of their health?
We did put a pause on screening mammograms for a couple of months between March and May, just because we wanted to diminish traffic, of foot traffic coming into the hospital and utilize our resources appropriately, given we were in that first surge. So certainly during the earlier months, I would say women did stop getting their mammograms for a little while, and then we saw it pick back up as women remembered to kind of take care of their own health as well.
What has changed since the pandemic as far as the safety precautions that are taken when someone does go to get their mammogram?
We're doing a great job with respect to cleaning all surfaces. We've always done that, but we're making more of a conscious effort, I think, to put that forth in front of patients, that we are cleaning the equipment in front of them, chairs, wiping down all surfaces. And we do regular clean checks throughout the day, I would say, at all of our sites. Also distancing patients and timing it so that, we don't have too many patients here at one time. Waiting rooms, of course, are set up with chairs turned around so nobody can sit in them so we can have more distancing.
Very good. So again, the awareness is there that if you received your COVID vaccine, you may see those swollen lymph nodes. Again, Dr. Sareen, thanks for joining us for this awareness segment here on SSPTV.
Thank you so much for getting the message out.
Today's news feature is brought to you by the Cheese Store and more. Come in and order a tray of their mini cannolis, and don't forget to check out their Facebook page for weekly specials.